Stoughton Hospital strives to meet the changing needs of the communities we serve. Our experts provide you with the information you need to make informed healthcare decisions. Here's Melanie Cole with Stoughton Hospital Health Talk.
Have you ever had that feeling of mucus that accumulates in your throat and you're not sure what that means? My guest today is Dr. Steven Lyon. He's board-certified otolaryngologist at Stoughton Hospital. Welcome to the show, Dr. Lyon. So people get that feeling. Sometimes it causes a cough. Sometimes they feel like it's a post-nasal drip. What's going on when we feel that throat drainage?
Well, Melanie, this is one of the most common things that people come to the office with complaints about. It's very, very common. And so I think it's important to have people understand some of the major causes and make it so that they can describe these things to their doctors and help the doctor come up with the proper treatment. And this is really mostly drainage that you feel, but you can't usually see abnormal drainage. You can feel an abnormality in your throat or in your nose, and you feel like there's something there. But it's important to remember the nose, and this is something that really surprises people because of the volume, the nose puts out 2 quarts of mucus a day. And of course, your mouth is always putting out saliva. And this runs down the back and is actually there to lubricate your mucous membrane. The lining of your nose and your throat are supposed to have mucus. That's why we call them mucous membrane. So the idea of post-nasal drainage is kind of a funny misnomer, because really we all should have mucus and drainage in the throat. The question is, if we feel it, what's going on? Why is there that sensation? Why does it feel abnormal to us? And so everybody can really produce some of that mucus. We can always spit up a little bit of it, but trying to understand what really is behind the problem is going to help you get to the solution. And it's really important to understand that it's not all about allergies, though allergies can be a cause. You need to think about the individual symptoms, help your doctor with a diagnosis, and help you with the proper treatment. If you go in and you say the word drainage and it's not drainage, you may get treated for drainage, and then it won't get better. So the first thing to understand is that these causes aren't necessarily individual causes. They frequently overlap, and many people have more than one. You mentioned things like smoking and other sources of throat irritation, and anything that can irritate your throat can either dry your throat or make it feel like there's something stuck in there. And that will give us a sense or enhance a sense of post-nasal drainage. So we have to think about all the sources of throat irritation, whether it be smoking or working in a dusty environment or irritation from chemicals in the environment, or some people are very sensitive to smells and perfumes and additives and things like that. But one thing that I like to have people first understand is that they should separate the sensation of postnasal drainage or nasal drainage from the dripping out the front, the watery, drippy, runny nose that people sometimes get. And that comes in basically 2 varieties. There's something that we call vasomotor rhinitis. It's frequently the older person who comes in, the nose runs like a faucet, and they're constantly having to drip and blow their nose, and they have a handkerchief at the ready all the time. But they don't have typical symptoms of allergies like sneezing, and itching, and runny nose. And sneezing and itching and scratchy eyes. But they do have that watery, drippy nose, and sometimes that's made worse by having a meal, smelling the smell, going outside in the cold, and changes in temperature and things like that. And that's not post-nasal drip. That's a drippy nose, and that's something that requires a different treatment. But that's not what we're really talking about today. Another one is allergies. Of course, allergies increase the volume of the mucus, and they can have that mucus either come out the front and drip, or they can go down the back, and that produces some actual increase in the nasal drainage. But it's usually accompanied by symptoms that we're all pretty familiar with because allergies are so common. Things like the sneezy, itchy, runny, the watery, scratchy eyes, scratchy throat, that sort of thing. And sometimes we know that there's an exposure, whether it's pollens or trees or grasses or molds or animals. We generally have a sense that there's an exposure that can make this worse or trigger this. But some of the causes of the sensation of postnasal drip aren't necessarily quite so straightforward. And there are many patients who have swelling of their mucous membrane and the structures in the nose. And they'll feel a sense of drainage in the nose that when they blow their nose, nothing comes out. And when they move from one side to the other when they're sleeping, the drainage seems to move from side to side. And we all sense this to some extent because some of this is normal as the blood flow switches from side to side with the changes in position when we lie down or when we're sleeping. But for some people, this is much more pronounced. And so this is the sort of situation where it's not really a drainage, it's not really abnormal mucus, it's filling up of your nasal cavities with the tissue that becomes swollen in your nose. And unless we treat that swelling or understand what's causing the swelling, we won't really get any relief from that. And there are certain medications that are common in causing or making this sort of thing worse. And one of the most common is medications that people are on for their prostate or to be able to urinate, because that tends to cause these mucous membrane to swell. As I said, they frequently don't come alone or singly. Many of them are associated with other problems, whether you have obstruction from a combination of things, whether it's what we call a deviated septum in the nose and crooked breathing passages, or a combination of those with allergies or chronic sinus problems. Another common source of what people refer to as post-nasal drainage is simply actually dryness, dry mouth, where people feel like their mouth is parched, sticky, and thick, and it makes it a little hard to swallow. And this sort of thing, in contrast to having more drainage, actually has less mucus, less drainage in the throat. It doesn't feel normal. It doesn't work normally, and neither does the nose. When the nose is dry, it feels stuffy. So the key here is to increase their intake of water. Use maybe a nasal moisturizing spray. Keep a little cup of water or water bottle at the bedside so that you can moisten your throat if you wake up with a dry mouth. Or use things like salivary replacers. And this is another thing that is aggravated by smoking, because if your mucous membranes are dry, then they're not protected well. And then if you smoke and you're using your throat like a chimney, then that smoking can aggravate any irritation in your throat and make that sensation worse. Now, one of the other frequent causes of the drainage sensation is actually what we call reflux. Many people refer to this as silent reflux because it doesn't cause overt symptoms that they're familiar with, like heartburn. What do people get when they have reflux, and how can you tell if that's the source of your post-nasal drainage symptom? Well, people tend to have symptoms that are with reflux that are worse in the morning. They'll feel like there's a glob in the throat or a sense that there's drainage stuck in the throat, and they'll clear the throat frequently, so that this sort of thing. But they won't see much actual abnormal mucus coming out. And frequently, because the stomach acid has actually traveled up the esophagus and into the back of the throat, they can get hoarseness because it can irritate the vocal cords, so they can get sore throat. And so these people will benefit from dietary changes and potentially being on a medication to reduce the acid level and make it so that it's not quite so irritating. But things like not eating late, not going to bed or lying down or exercising with a full stomach, sleeping with the head of bed elevated, and that sort of thing. But this is something that's not clearly associated with a real post-nasal drainage or drainage that you can see, but it's a sensation of drainage.
So, Dr. Lyon, you've given us so many different bits of good advice about why this could be caused, things that we can do. So wrap it up and give us some things that you really want people to first try at home. And then if this is still a problem, something that's really aggravating them, and as you say, causing coughing and all of the things that make life very difficult for somebody with severe throat drainage, give us some home remedies, things you want people to try, humidifiers, nasal sprays, whatever, and then tell them when they really should see a doctor.
Well, I think that's really what it comes down to, is trying to get relief. And one simple way to think about it is if it's dry, wet it, okay? It's the nasal saline and drinking an extra drink or two of water. Those are things that are simple to do and give you a simple answer about whether that's playing a significant role in your symptom. Cutting down your smoking. Looking at the sources of potential irritation in your nose and your throat, and removing those sources of irritation. Smoking is a simple one to recognize, but not such a simple one to defeat. It's important to take that next step and try and reduce or stop the smoking. pay attention to signs of, for instance, chronic sinusitis. Patients who have maybe pressure sensation and really will have occasional very, very thick or abnormal glue-like secretions that come out. And those patients will frequently benefit from nasal irrigation, and many patients who have that and other sources of inflammation can use a nasal steroid spray, which now some are available over the counter for use. But I think it's important to take these steps at home to try and narrow down some of the possibilities, see what gives you relief, see what doesn't give you relief, and that's more information you can bring to your doctor so that they can understand what steps you've already taken and what other medications or possibly changes in the medications you're already on, because those might be contributing to some of the symptoms too. But there are lots of options. Certainly if people have allergies, then the use of the nasal steroid sprays or potentially antihistamines to control their sneezy, itchy, watery, runny symptoms can go a long way to helping these symptoms. But the important thing is to think about what the possible causes are. Try and manage some of the more common causes at home, decrease the sources of irritation in your nose and your throat, and keep good notes so that you can give those ideas to your doctor and help guide your doctor's treatment if the treatment at home doesn't help.
Thank you so much for being with us today, Dr. Lyon. You're listening to Stoughton Hospital Health Talk. And for more information, you can go to stoughtonhospital.com. That's stoughtonhospital.com. This is Melanie Cole. Thanks so much for listening.